I suppose there's an element of, I don't know, embarrassment or shame about it. Um, Among family, I'm sure just not my own, but other families as well. But it also, I think, sent a message that um, it's common, even though it's not talked about. So it's common back then, and I'm sure it's still common now in many other families. My name is Dr. Ronald Del Castillo. I'm an associate professor here at the College of Public Health at UP, Manila. I encountered a graduate student who would binge drug like once a month. And he would use drugs like a lot, and a lot of hallucinogens, and because he saw the drug use as a way of, again, recreationally, and so he would like go into these hallucinations that he enjoyed. It really instilled for me that despite the drug use, it is possible to have that connection with a client, with a patient. But I think that was particularly important to me because I saw him really as a person who was struggling with other, especially in his intimate relationships and his family history. I saw him as that, as a person wanting to thrive and grow. Over time, it really was less about the drug use and the alcohol use. It was really more about him wanting to reach out. I think empathy is very important because I think empathy opens you to less judgment and more, I guess, hope that they are like anybody else. You know, maybe they feel lonely, maybe they feel rejected, maybe they don't know how else to manage whatever thoughts and feelings they might have, and so, you know, drugs and alcohol might be easier to use in order to manage whatever difficulties they're having. You know, short of safety concerns, you know, I'm less concerned again about the actual use of the substance. It's about how can we help you thrive, and again, that's really only possible if there's less judgment on your part as a person. Yeah. One client who at that time I think was in his 40s, he gave me a gift at the end. He knitted a sweater, because throughout our sessions he talked about how knitting was his way of coping, and so at the end it turns out he was knitting me a sweater, and he told me that I think what worked for him was being heard and being listened to in our conversations. Teaching other people or encouraging other people to do the managing of their drug use or alcohol use is easier when they also feel like they've been listened to and heard. I don't make my views on this secret. I think it's too clinical. I think it's too medical, the approach here. I think it's too punitive, especially when it comes to drug use and alcohol use. We see them as wrongdoers, if you will, rather than as people who want help. I think our current approach right now is, in some ways, sadly not surprising, because I think there's a culture here of punishment, where we believe as a culture that punishment works to change behavior. Punishment doesn't work. It doesn't work. It just doesn't work. The punitive approach, it just does not work. Whether in a drug issue or whether or not you're taking care of a kid, like punishment just doesn't work. And our punitive approach is a sign that we do not know what else to do. So we revert to our natural course of action, which is to be punitive. I do think that people who want help, whether it be for drug use or alcohol use, should be provided with with that kind of whatever help they need, whether it be for them and their family. So a supportive approach in the longer term is much more effective. I think we as a culture send the message that there's something wrong with you as a person, right? There's that judgment, right? That, oh, you're a failure, like you shamed us, you embarrassed us, or as a family, because why are you using drugs? Like, to me, that sends the message that there's something wrong with you as a person. And I think I would say to that person, I think that that's a mistake, and that's not okay to tell you. There's nothing wrong with you. You're a good person. The behavior maybe we're not keen on, right? The drug use, the behavior maybe is affecting you, your family, your job, your school, and that's the part that we need maybe to work on when you're ready and willing. But you, as a person, there's nothing wrong with you.